Hi, everyone. Greetings from beautiful, sunny Seattle. We're so excited to have everyone here joining us today on a webinar coming from the Seattle Indian Health Board, a federally qualified health center located here in Seattle, Washington, where the Urban Indian Health Institute is located. The Urban Indian Health Institute is a tribal epidemiology center, one of 12 located across the United States. Our role is to provide tribal nations, urban Indian communities, and all other American Indians and Alaska Natives with relevant information related to public health. And as you all know, right now, this country is in the midst of a pandemic with COVID-19, the novel coronavirus. So today we wanted to bring to you some information related to one of our most incredible, resilient, strong communities that is part of our American Indian and Alaska Native communities, and that is our homeless American Indian Alaska Native folks. So we wanted to bring to you some relevant information on how to serve those who may be more vulnerable and at risk for COVID-19 using the best science that is there, the current recommendations, but also recognizing that we have to do harm reduction and know that we're not always going to be able to meet what the CDC is wanting us to do for our homeless relatives. So today I'm excited to have my sister here with me. I'm Abigail Echo-Hawk. I'm an enrolled citizen of the Pawnee Nation of Oklahoma, and I was born and raised in Alaska amongst the Upper Athabascan people. And I am the director of the Urban Indian Health Institute and the chief research officer here at Seattle Indian Health Board. And today I'm joined by my sister, Colleen Echohawk, who is the executive director at the Chief Seattle Club. And she'll be doing an introduction here in a few minutes, but we're going to go ahead and get this webinar going. I want you all to know that if folks weren't able to register and you have some people who may want to see this, you can go to our Facebook site, Urban Indian Health Institute, UIHI, on Facebook, where this is also being live broadcast. They can ask questions through Facebook, and you are also able to ask questions through the question and answer chat box here on Zoom. So we have multiple ways for people to get in and get information if they weren't able to register. So please share that with your colleagues if they were unable to register, because we did reach capacity on the webinar. So again, Abigail Echo-Hawk and my sister Colleen is with me today, and I'm really fortunate to have such a knowledgeable person who has been working with the homeless American Indian Alaska Native community here locally in Seattle and has now started an effort nationwide, and she'll talk to you a little bit more about that. We have some really specific objectives today. We want to provide some information on COVID-19. We know everybody is inundated with information right now, but there are unique circumstances for homeless American Indians and Alaska Natives. And Colleen will be able to share with you some of the lessons learned from on the ground. I will also be sharing with you some of the things that we're doing here at the Seattle Indian Health Board, a federally qualified health center, again, to protect and to serve our homeless American Indians and Alaska Native accessing our clinical services. After Colleen, we're going to provide some key recommendations on what to do before an outbreak. We know we're in the midst of an outbreak, but this is still important because it allows you to think about what kind of plans you need to have in place. And if you haven't had it reach your city, your state at the impact we've seen here in Seattle, this gives you an opportunity to really start planning what to do during the outbreak and to what to think about after the outbreak, and then we'll have some question and answers. Please continue to put your questions into the chat box as this is going on and into the Facebook Live. We'll be answering some of those when we can on the spot, and others will, Colleen and I will answer after. So I'm just going to do a basic of what is COVID-19, the 2019 novel coronavirus. It is a viral respiratory illness caused by coronavirus. So this hasn't been found in people before, and it can lead to lower respiratory, so breathing issues like pneumonia and bronchitis. So symptoms include a fever, a cough, difficulty breathing. But what we know about these symptoms is they often can wait as long as 14 days after your exposure and actually having the virus before these symptoms actually occur. And so most people will only have, mild symptoms similar to what the flu would kind of be like. But for those 20% that don't, it actually has huge impact on them. So 15 to 20% will experience severe symptoms that could require hospitalization and other supportive care from medical personnel. So there are certain people who are more at risk for contracting this virus, and this is adults over 60, people with serious medical conditions such as heart disease, diabetes, lung disease. And again, with the folks who are over 60, it's really important for us to think about them and our elders and these underlying medical conditions. What we also know is there is no one who is immune to this, no one. So if you think, well, I'm healthy, I'll be fine, you probably will. Your immune system is probably strong, but you are not immune to this, which means that you could contract this and spread it to those who are more vulnerable. And that's why there are such serious recommendations right now in terms of social distancing, doing things to prepare yourselves and to ensure that you're not passing this on to other community members who could have more serious consequences. So what's the current status of COVID? Right now, the Urban Indian Health Institute is a tribal epidemiology center. I have 9 epidemiologists who are monitoring this on a daily basis. We know globally there is more than 200,000 cases with almost 9,000 deaths. In the United States, we have more than 10,000 cases and 150 deaths at this point. Here in Seattle, both Colleen's organization and the Seattle Indian Health Board, where I work, we have had more than 50 deaths here in the Washington area, and most of them have been located in the county that we are living and working in. So we have been in the epicenter of this crisis for a little bit of a longer time than other folks, and that's why we want to share some of the information that we've learned, and to recognize just because your state may only have 1, 2, 3 cases, expect that to grow and expect it to grow quickly. How is COVID spread? We know that there is person-to-person spread now. Initially, it was thought that was just coming from travelers, but now we know that it's going through person-to-person, and happens when somebody coughs and their respiratory droplets are in the air and somebody breathes them in, or they touch a contaminated surface. And so it's between people who are in close contact with each other, which is why we recommend social distancing of at least 6 feet. We are also going to work on, and I know that I'm hearing from my team right now that we're not live streaming on Facebook. We're actually going to go ahead and keep going, and we'll have to have the live Facebook feed catch up with us so that we can stay on time. And for folks who are on the webinar can ask questions. We'll share that and share this webinar on Facebook later. But we are working on the issue. They just let me know that it's not being shared on Facebook Live yet. So when we talk about how COVID is spread, we want to make sure that we're, staying 6 feet apart, that we're using hand soap, we're washing our hands for 20 seconds, we're using hand sanitizer with at least 60% alcohol in it. But one of the other best ways to prevent and to make sure you and your families are taken care of is to make sure you have a strong immune system. You know, a strong immune system is very important, and it allows for our bodies to be able to, if you were to get the virus, and to resist a virus that might infect you, for the strong immune system. So get outside in a isolated area, get some sun, take a deep breath, take your vitamins, exercise, do everything that you can to keep your immune system. Because one of the other things you need to do is to avoid touching your face, large social gatherings. Again, I can't say it enough, try to stay 6 feet apart. And if you have someone who has symptoms, you really need to isolate them. If they're in your home, you would want them to be in their own room. You would want them to wear a mask. And all of us should have enough food and supplies that if you had to do a 2-week quarantine of your family in your home, and I'm talking to all of us on here, that you have that available. And cover your coughs and sneezes, and sanitize, sanitize, sanitize. So I just made a whole bunch of recommendations, and for those of you on this webinar, if you are serving or work with homeless folks, you know that most of what I just said simply isn't going to apply. And one of the things we have to think about is, how do we serve our relatives who are currently unhoused and homeless in a way that understands their situation, but does everything we can to prevent any harm to come from them. So your agencies, social service agencies, everything we're doing, your state health departments, your county health departments, are absolutely essential to think about how we do harm reduction for our homeless Native folks, because we know we have some unique challenges. And in fact, when we look at outbreaks of influenza, hepatitis, TB, we know that the homeless population has been disproportionately impacted because of the unique challenges, such as not being able to self-isolate, having and living in places and shelters and encampments that are really crowded, They may have underlying health conditions. And for some of our relatives who do have current employment, it may be employment that doesn't have sick leave or is protected if they don't come in. So one of the things we wanted to do is to ensure that we can reach those folks. And we want to talk to you a little bit about what our organizations have done, but leading with Colleen first, and share some lessons learned from an urban Indian homeless organization. So I'm going to pass this on to my sister Colleen Echohawk, who will introduce herself. And I am going to thoroughly sanitize the little forward clicker, so that, again, we're practicing what we're doing.
I don't know if you did thoroughly.
Well,
give it a second.
All right, thoroughly.
Hi, everybody. It is really wonderful to get to share a little bit of the work that we're doing at the Seattle Club with our friends and relatives out there. Really, this is because we care so much about our relatives who are experiencing homelessness. And so I'm really grateful for the Urban Indian Health Institute, for my sister, for the Seattle Health Board, and for just this community that's come together and is working on behalf of our relatives. They are pretty incredible people. And we're excited to just share with you a little bit about what we're doing. So I am, as Abby mentioned, we're sisters. So I'm from the Pawnee Nation of Oklahoma, also belong to the Upper Athabascan people. Shout out to all of our folks out there. And I'm going to share with you a little bit about what we are doing at the Seattle Club and why we're responding to homelessness. And some of the reasons is because we know that Native people in this country have some of the highest rates of homelessness. So there is a very disproportionate impact on our relatives out there, and we are doing all we can to support them. The Seattle Club, here's a couple of statistics actually from around the country. We know that in Anchorage, Alaska, where it gets very, very cold, 60% of the homeless population in Anchorage, Alaska are relatives, Alaska Native folks. We know that in Minneapolis, that our Native families, our Native elders are 27.1 times more likely to be homeless in Minneapolis, where it also is very cold. And we know that here in Seattle, 10% of the homeless population is American Indian Alaska Native. That means that about every night here in Seattle, we have about 1,100 folks that are not in shelter. We know that Native veterans are the most likely to not go into shelter. So there is a lot of troublesome statistics out there and a lot of work for us to do as we recognize these numbers and take action on them. I am super fortunate to be the executive director at the Seattle Club, where our mission is to provide space to nurture, affirm, and renew the spirit of urban Native people. And we do that by being very active in supporting our folks through a day center. We're open 7 days a week. We have Native people that come in all day long. We offer food, showers, laundry, and then other services like housing, eviction prevention. We also do a ton of work in the spiritual healing. We work with some really amazing healers from this area, and it has been my privilege to get to do this work. Because of how significant this issue is, I also was lucky enough to help found the National Coalition to End Urban Indigenous Homelessness. And we're planning on launching that in July with some of our folks around the country. Now we're not exactly sure how that will happen, but I just wanted to invite you to check out our website and know that we're doing our best to provide policy that is going to impact this community, and also just practical things like we're doing today. And that's what I want to move into now is like, what can we do on a practical level right now, day to day, for our folks who are out there. I worked in our day center on Monday, and I came into contact with a really amazing grandma. I came and she had with her a baby. She was 4, not really a baby, but 4 years old. And then also her son. They've been in and out of shelters, but because the shelter system is not set up for that kind of family, that's another really hard thing about our shelter systems. And so they were often separated. The grandma and the granddaughter would go off, and then her son would have to go into another shelter. And they don't like that, right? So they are often sleeping in a tent. I happened to see them. I know that this grandma has really significant lung issues, and we were able to get them into a hotel room that night. And that's a strategy we're going to talk about a little bit later. But that's just an example of who is out there and who is really going to be suffering from this virus. And so it's important that we do everything we can to support them. We're doing that at the Seattle Health Board here, where I'm at right now. I came in and it smelled like smudge. You could tell that there had been a lot of sage going on. We just really want to remember our traditional medicines as one of our first defenses against this virus. I know that at the Chief Saddle Club today, we have smudge spray that was made by an amazing woman, Valerie Seagrass, for the Muckleshoot tribe. And those are traditional medicines, are some of the first things that we can do to support our relatives who are experiencing homelessness. One of the things I want to mention is that communication around this is incredibly important for our relatives experiencing homelessness. They are often inundated with all kinds of messages and are experiencing their own kinds of trauma. So continuing to message over and over and over again. Again, when I was there on Monday, there were several people that did not even know that the virus was happening. They were wondering why the libraries were shut down, why the community centers were shut down, but because of all the things they were experiencing, they were not really tracking what was happening. So keep sharing as many methods as possible. If you go into my agency today, there's signs everywhere. Our staff are constantly talking about it, and that's going to be an ongoing communication as this virus continues to unfold around the country. Oh, and then here's a really awesome picture of the smudge spray. You know, we want to continue to be asking our members, or we call at Chief Seattle Club, we call our clients members. We want to just continue to ask them to be taking those deep breaths, remembering who they are as Native people, and not getting kind of caught up in all of the anxiety of this crisis that we're in right now. And again, here's a picture of the smudge spray. Really, again, incredibly grateful for Valerie Seagrass, the Muckleshoot tribe. There's cedar, sage, and sweetgrass, and rose. And we're handing those out today and inviting people to spray their faces, spray themselves, take it out there as protection against this virus. One thing that we really want to ensure too, and with our community, is to be offering assurances to our folks. You know, it is a frightening time, and I'm going to talk about screening in a minute. But one thing that we saw right away when we started the screening process was people were afraid, and they're afraid because they need those services. They're afraid that if they do show symptoms, that they're going to be kicked out, or they're not going to be able to participate in our programs. And so, and they need those basic programs that we do. So it's really important just to offer those assurances, say, you know, we're gonna help you, we're gonna assist you, we're gonna make sure that you get the medical care that you need. But I wanted to offer that right away. When we have that trauma-aware lens, we really have to be assuring our relatives that we're gonna be with them and take care of them. We want to talk a little bit about the screening. We implemented this screening process at my agency on Saturday, and it's been going pretty well so far. It's always a little bit bumpy, but we have people are lined up in front of our door at like 6:30. We open up at 7 a.m. And first we're asking people to wash their hands, and you can see that you can rent hand washing stations. I highly recommend this if you are in an agency that is maybe small. We tried to put this one outside of our door to get them before they actually come in. However, that did not work out, but we have it right inside as soon as you come into our lobby, and this is an opportunity just to get that. And if, you know, you can rent these from like party stores, and I highly recommend doing that right away. We got one of the very last ones that were available in Seattle because you know, they're highly needed right now. We also know that washing your hands is one of the best ways we can protect ourselves from this virus. So we also opened up other hand washing stations around our building. So that was the first thing we're asking people to do, is wash your hands. Then we're asking, do you have shortness of breath? Are you coughing? Do you have a fever? Would you like us to check you for a fever? And have you been exposed to anyone with the COVID-19 virus? One thing that has been really clear to me as we've been implementing this screening process is that I think that some folks were maybe not being quite as honest as we'd like them to be about how they were actually feeling. And that's something we're going to have to continue to understand as this rolls out. We know that our homeless community is under has a lot of stigma against them already, and so they're not really excited about sharing how they feel because they're afraid they're not going to get the services and don't want to fall in that category. So we're going to have to continue to understand that and understand the trauma that they're experiencing. After screening, we're asking people to wear a mask. And, you know, one thing that we've been doing around our agency is staff have just been wearing masks. Now, we know that the masks are not going, like these kind of masks you see on the screen, are not going to protect you from the virus, but what's important, if you are showing those symptoms, it's important to be trying to stop the spread of that virus through coughing and that sort of thing. We asked our staff to kind of wear them and model them. We've also tried to model at like meal times, like getting your temperature taken via a thermometer on your forehead. We're just trying to like kind of just, you know, make it more palatable, help our folks understand what's going on. The other thing is we're also, if there is someone who's exhibiting those symptoms, we're asking them to go into a separate space away from the crowd of people. We serve over 100 people a day. Sometimes we serve 180, 200 people a day. So there's a lot of people in a pretty small area. So we're asking them to go into a small room. And frankly, we have not had to do that yet. But we're ready to do that if we need to. The other thing is reminding people after screening to like do some social isolation, and we're explaining that by like just trying to keep some space between you and another person. Ideally, I think that the CDC recommendation is 6 feet. Honestly, in our space, we just don't have enough room for that, but we're trying to keep messaging and encouraging that social isolation. The other thing is we're promising transportation to clinic or hospital. We're so lucky to have this amazing partnership with the Seattle Indian Health Board, and we're ensuring them like, you're not going to be alone in this. We're going to go with you. We're going to ensure that we can take care of you. We even here in this city, we have a lot of access to Ubers and Lyfts, so we're ready to do that. We're ready to do whatever we have to do to make sure that they have adequate transportation. The other thing is that our bus system has decreased a lot of their routes, so we're at a lack of public transportation for our homeless community. This just came out this morning, and it's something we haven't really had a chance to totally process, but we know that our homeless community relies on public transportation, so that's something that's going to be of significance in the upcoming days. I know that when I've been working every day, I see the buses, and the people that are getting on the buses are our homeless community, and there's not a lot of other people on them. So that's a real reality and where we're at right now in Seattle. The other thing, the final bullet is just to stick with your relative. Assure them that you're going to be with them through this process as much as you possibly can within the real confines of this system and of how we have to be able to protect ourselves from the virus. So be focused on trauma resilience. I really love this picture of one of our favorite members of the T Seattle Club. You know, be aware of your tone of voice. You know, be gentle, be encouraging and comforting to someone where we're sharing all of these things, because it is hard to hear if you haven't heard it. It is hard to have to go through the screening process. So just be aware of your tone of voice. Keep assuring people that they're in a safe place, that they're in a place that relatives are going to be taking care of them. I'll be ready to offer those medical resources. We're again fortunate with the Seattle Health Board with this strong partnership, and it's only about half a mile away from our center, but looking for the resources around you and make sure you know where you're going to send them. I will say that as this is rolled out with King County Public Health, we've had mixed messages about what to do and where to send them. Right now, We are working with the Family Health Board and a hospital close by. So just be aware of what those medical systems are around you and be ready to take someone there if you need to. I think the other important thing is being trauma resilient and being trauma aware in this time is to be ready to listen. We have lots of questions from people, a lot of people just wanting to talk out their fears. And so again, we want to do as much as we can with that social distancing. So I invite you to think about wearing gloves and really just modeling that we need to be extra careful right now with our homeless relatives. It's highly important that we continue to message that. And then offer a lot of information. We have a bunch of one-pagers that we're getting from the Department of Public Health, just letting people have all of that information so that they can be as informed as they possibly can is really important and will help alleviate some of the fears. And then again, just be really gentle and caring and loving about what's happening, because this is our homeless community is ongoing having trauma in their lives, along with the historical and generational trauma that we all experience. So this is even more traumatic, and just having that gentle spirit, kindness is going to go a long ways in helping keep people safe. We also have put into place a risk reduction plan. So, we have a tremendous staff. Again, we're open 7 days a week in support of our homeless relatives. And there's a lot of concerns about, the exposure, right? It'll be a surprise if we do not get someone who does have the virus. And so our staff are exposed. So we have been working very hard on understanding that. What we have come up with is being able to reduce the hours of our agency. We've reduced it by 2 hours. That is to reduce the contact that the members have with staff, but also it's for the good of our relatives who are out there. If we're open our full 8 hours a day, that means that they're in a tight space with a lot of people, and their risk of getting contamination with each other is high. However, we have the dilemma of wanting to be able to offer our services. They need to eat. They need to go to, our libraries are closed, our community centers are closed. People need bathrooms. And so it is incredibly important that we stay open and provide those basic services and figure out how to balance that need. So other things we're doing is sanitizing every half an hour. We're wiping down every surface. We're doing door handles, everything we possibly can. We're also wearing gloves all the time so that we can do the best that we can to stop any contamination. We're sure that there is going to be someone that does eventually get the virus in our center. When that happens, we're ready to close down temporarily and do all of the cleaning that we need to do and then reopen. Other things we've done, just like within our dining area, is to move chairs and tables. So we've taken out some chairs, we've moved things so that people aren't as likely to sit as close to each other. Again, we're modeling physical distancing so that our members and our relatives experiencing homelessness can understand what that looks like. We moved some of our services into an area that has better ventilation, right? Our day center downstairs was kind of closed in a basement. Now all of our services are being provided in our dining area, which has great ventilation. We're opening that door. We're just trying to keep things moving. We're encouraging people to move through that center more quickly than they used to. It used to be a pretty good time to hang out, but we're inviting people to get those services and then move on. We're also doing things of reducing cross-contamination. We used to have an area where people could get their own coffee, where they could get their own salt and pepper and sugar, those kind of things. We've completely taken those out. Now if someone wants that, it's handed to them by a staff member who's wearing gloves. So we're just trying to think about every possible place that people could be touching and making sure that those are taken out so that we can protect them. We're staggering, we haven't done this so we don't have room, but it's possible to stagger meal times and be thoughtful about how that process is working out, because we just want to do the most we can to make sure people are not breathing in on each other and coughing and all of those things. we want to continue to innovate, and that's something I think that we have that's special in the Native community. We've experienced these kind of things before, and I think that we'll have some special ways to innovate that maybe our mainstream friends have not thought of. One thing that we started doing yesterday is moving people into motels. So we know that we have a ton of people who have some real medically fragile and are more likely to get this than someone else. So we've moved them, and we're starting to move people into motels. We are raising a ton of money right now, and we just thought, this is an emergency situation. When it snows here in Seattle, we move people into hotels. So like this is a proper response for right now. And that's just one way that we've thought about doing something that's different and innovative. We know that the food systems are going to be tough and are tough. So that's another reason we have continued to stay open, providing those basic food needs. But we're also working with Seattle Public Schools to be thoughtful about, are people actually going to the schools and picking up those meals? If they're not, we are going to try to figure out a way to get food out to our homeless community who are sleeping out in the encampments or are doubled up, and maybe don't meet the technical definition from HUD on homelessness, but we know we have tons and tons of families who are sleeping, with a lot of people, right? So, and we want to make sure that we support them, and that many of our families were getting food from the school system, and now we need to try to figure out how to adapt to that. And then we're also just really encouraging, again, traditional medicines, encouraging people with sage and sweetgrass, and really purifying our systems, purifying our spirits, so that we're ready to protect ourselves from this virus. So I know that there's going to be many other ways that we're going to be innovating around the country, and I really want to invite everyone to be sharing those. I mean, Facebook and Instagram, Twitter is such an important thing right now, that we can be sharing different things that are happening, and ways to be thoughtful about our relatives who are outside. So I want to pass this back to Abigail, and we'll probably go back and forth a little bit about infection control recommendations, and we'll be just sharing some of these best practices.
Yeah, thank you so much, Colleen, for sharing everything that you're doing. It reminds me a lot of what we're doing here at the Seattle Indian Health Board. As a federally qualified health center, we're often serving our relatives who have been most marginalized and pushed to the edges, and not having the access for both healthcare and good community care here in the city of Seattle. And I know in many cities across the United States, it's the same. And so one thing that I love about what Colleen was just sharing and what we're doing here, so when I walked in this morning, the first thing I saw was one of our traditional healers walking around and burning sage. So we know the science, now Western science says, but we as Native people have always known this, that saging actually will kill about 98% of all of the bacteria in the air. So it won't kill this virus, to be clear, but it will kill other bacteria in the air. So it is a scientific way of clearing the air, again, keeping immune systems really strong, but it also is one of those ways that we as Native people have always stayed strong, and that is through our traditional ways of medicine and prayer. So this traditional healer yesterday, when I saw her, she stopped me, I did the sage, we offered a prayer, and I left feeling better. And we know that one of the things we need to do is to alleviate stress. So as I go through and I talk about infection control recommendations, the one thing I want you to think about this with is it's not about fear. And I think a lot about what's coming out around COVID-19 has been fear-based. This is about loving our people in a new way, loving them and caring about them enough to ensure that they are not at risk, as high of risk of contracting COVID, and it's loving them enough for our community to do things for those who have homes to stay within them, for those who can to not go into work. We are loving our people in a new way, and we have this opportunity to evolve and use our traditional ways of knowing to do that. So our traditional medicines have always been known to boost immune systems. So I know here in the Pacific Northwest, the use of nettle and elderberry, other traditional foods in Alaska, where Colleen and I are from, eating the salmon full of those omega-3s, those fattiness, our blueberries so full of antioxidants and vitamins. Those are all immune boosters. And so for those of you who have access to get traditional foods to your peoples and traditional medicines, we really encourage you to do that. And again, I think that's one of the ways we as Indigenous peoples are leading in this response, is that we have not only our spirituality, but we have our culture, and we have the knowledge systems from hundreds and hundreds of years of ancestors who came before us. So in this sense, I think that we have an opportunity to serve our people better than I think other communities do. And I really hope that they can learn from what we're doing. So I'm going to start with kind of talking about before an outbreak, and Colleen talked to you about this, but here at the Seattle Indian Health Board, we had a plan in place. We are a federally qualified health center. We have a plan for emergency outbreaks, and we put that plan into place the moment that we knew that this was something that was coming into the United States and something that we needed to be concerned about. In California, the governor and his staff there released this incredible guidance for a homeless assistance, looking at how providers who are assisting homeless folks can make a good emergency plan. If you don't have one in place, start putting together an emergency preparedness plan. There are things that you need to really think about, including anticipating staff changes. You're going to have some high-risk staff like we did here, Seattle Indian Health Board. We've implemented a policy where all of our high-risk staff are working from home, and many of us are rotating in and out on a telework basis. So you're going to have staffing changes. You might think about, do you want volunteers in your space right now? It really doesn't seem like the best time to have volunteers. So you have to shut down some of your programs and think about what that does when you close down those programs. You need to train all of your folks on this emergency preparedness and think about how you are going to manage your clients. And I know that one of the things that we're doing here is that we have housing management that we do at Seattle Indian Health Board. They do at the Chief Seattle Club. We have switched to completely doing that via phone instead of going out and meeting with people face to face like we used to. And so we're still doing our housing management. We're meeting the needs of our homeless relatives to the best of our ability, but we are not having our staff interact with them for this particular service face-to-face anymore. For those who do come in to our agency, we have double screening in place. Before you come in the building, there's a little tent you go through. Then you're sent to another place for another type of screening. And if you have screened where you may have symptoms of COVID, we have a quarantine wing set up here at Seattle Indian Health Board. So this is the implementation of our plan that we were able to put in place that included everything from anticipating staff changes and having our client management done. And we also have to recognize that with our staff, particularly in my agency, and I know Colleen's, a lot of them are American Indian, Alaska Native themselves. And so we also have to recognize with this generational historical trauma, we have to think about being trauma informed, not just with our clients and our relatives, but also with our staff. So even thinking about how you're communicating this and all of the changes to your staff should be done in your emergency preparedness plan. During an outbreak, which we are in the midst of right now, we've been in this for a while now. It seems like, I don't remember the last time I got a full night's sleep. We have to really, again, put that plan into action, keeping sick and high-risk volunteers and staff at home. We don't want to be going face-to-face with sick clients. So doing those screenings, having those hand-washing stations that Colleen talked about are really, really important. And once again, if you identify folks who need a mask, having those, there's actually some recommendations out there. Again, if you can't find masks, there are people actually sewing them. If you look at the CDC, they're like, if you have nothing else, you use a handkerchief. I think about all the incredible seamstresses and artists that we have in our community. You know, I can't wait to see the next beaded version or Pendleton version of a face mask. Ribbon mask, whatever's coming out next. These are opportunities for you to contribute to your homeless agencies who may not be able to get what they need. Limit visitors. If you have a shelter, if you have places where visitors come in to meet with the folks who are there, you need to limit them. It's not about banning. Again, it's about loving our people in a new way and limiting them so you ensure that they're not coming through, and if they possibly could have this, that it was, again, increasing the possibilities. And this is another way for that harm reduction to do. Always think about the traditional medicine parts. I'm going to say that like every 5 minutes. And in thinking about getting folks with housing, like Colleen said, it's really important. And again, I'll say it here at the end, but the governor of California did something that was really unique in that he declared homeless individuals as the top priority. And so in doing that, that allowed for the state, and it's allowing for their public health jurisdictions, from what I've seen, I haven't been able to talk to them individually, but from what I've seen come out in the news, it's allowed for them to direct resources, again, to our relatives who are at the most risk. So there are some policy implications and things that you can do as in your midst of this outbreak, and recommending and doing things that can serve your clients well. For your outreach workers, and here at Seattle Indian Health Board, we have a number of outreach workers who are out every single day with our homeless relatives, getting them housing, doing whatever we can for them. The continuation of any outreach is really going to depend on the staffing needs of your facility. This may be the time to pull in all those folks. If you have folks who are high risk, they definitely shouldn't be doing any street outreach. I know that as I've talked to some people, street outreach is something they feel they have to do for the reasons Colleen was just talking about. There are so many in our population of people who simply don't even know what's going on, and they're getting out there and trying to get that information. If they are doing that, have them do that in the safest way possible, again, in a harm reduction way. Have them wear gloves, have them model what Colleen was talking about, putting on the mask, not necessarily because, you know, we know it only prevents if you have it yourself, it prevents you from spreading it, but it's modeling the behavior and making it more normalized. And if you have to do that, really think and put that in your plan about how you're going to serve your outreach workers. And again, washing hands frequently. I know there's like this mad rush on hand sanitizer. It needs to have a 60% alcohol in it in order for it to appropriately kill this virus. But the best thing to do is actually hand washing. 20 seconds of hand washing is more effective, if done properly, than the hand sanitizer. So for your staff, that's why when Colleen was talking about getting that hand washing station, that's a really important thing to do. Still use the hand sanitizer, but for your outreach workers, they need to be taking into consideration everything they can.
Jump in because we got a question about specific recommendations for those without access to hand washing stations. And I think that's a big concern. There's a lot of education that we want to do. Again, communicate to our homeless relatives. I think that, any kind of wipes that you might have and be able to hand out to people. Again, giving folks hand sanitizer is important. And also just reminding them, there was an article in the Seattle Times where they was talking about to someone who was out in an encampment, and they were actually like boiling water on their campfire and washing their hands. And, it seems so crazy that we're in that desperate of a time, but that's true. So if everything you can imagine for someone who's out in an encampment who has access to fire and some water, that should be something that we're encouraging them to do. And then again, the use of the hand sanitizer on top of that is important. And that's why it's important that the outreach workers that are out there to be sharing what's going on and giving it to them in a way that's trauma informed so that they can actually start taking care of themselves in a good way.
And this may be a new way for you to think about. I know a lot of agencies, including our own, give out little toiletry kits. You might be encouraging the use of those toiletry kits more than for washing hair, the shampoo, to wash hands at their encampment fires, for example. Again, we are doing as much harm reduction as we possibly can, and that would be one way to utilize supplies that you may already have, things you may be able to ask folks to donate. I know I have an auntie who's got a whole box of hotel shampoos, that these kind of things would be useful for your clients as they're going back out on the streets after they've interacted with you. So what are the ways that you can use what you already have? And that's really innovative. I want to give credit to these incredible people. They're so strong and so resilient. Like, that is true. So innovative. We should be learning from them that we can then take to other folks and to other people and share those lessons of the things that they're doing out there. So for all clients, you got to think about the check-in. What Colleen talked about in doing that screening in the very beginning, very, very important. I would suggest every single agency has that at check-in. And in fact, again, here at the Seattle Indian Health Board, we have it at the beginning of our walkway before you can actually get into the building. And we have 2 levels of screening. If you have a shelter, really think about spacing out sleep arrangements. And if you're running low on space, think about how you're arranging the beds. People should be head to toe. And if you can stagger those out, then you should. And even thinking about the bedding, when you need to change the bedding in between each person. And when you're taking that bedding off, it needs to be done with gloves. You need to ensure that when you're taking it off, you don't shake it, because you could shake something into the air and your staff could then breathe that in, or other clients could breathe that in. So really thinking about being very careful as you change out any bedding. And also thinking with your trash disposal. Trash disposal is so important right now. How are your staff handling the trash? Who's taking it out? Where is it put when you take and change out each trash bag? Have really strong policies right now and proper trash disposal. It is so important, because if people blow their nose or they touch a bunch of things, food wrappers, whatever it is, as your staff are interacting with that, and as possibly some of your clients may, it's very important that your trash is done in a good way as to where it couldn't be a possible area of contamination.
I just want to add something too about shelters. I know that here in Seattle, we have some shelters that are incredibly packed. And so it's time to be really like talking to mayors and city council members and saying, we need more space for shelter beds. So we're opening up all kinds of new spaces here in Seattle. Big shout out to King County and City of Seattle. But that's taken a lot of advocacy from our homeless providers and from our homeless advocacy groups. So this is the time to start doing it. If you're out in some other city somewhere, to be asking for more shelter beds, because then you can separate. So for instance, we have a huge shelter that serves over 240 men here in Seattle. It's out on a Coast Guard warehouse, and they're tight. And so what they've done is they've moved like half of those guys into another shelter so they have more room, right? So they're not so face to face with each other all night long. And so those are the kind of things that are going to have to be innovating constantly about.
And I heard recently, for example, in Anchorage, Alaska, I know there's discussions about taking over a stadium or a music venue, things like that, to shelter homeless Native people. There are other states and other public health jurisdictions who are looking at, again, doing similar things and just buying spaces in motels to begin to give access to homeless service providers to have access to those beds. So right now, your communication as social service agencies to your public health jurisdictions, to your policymakers, are integral. If they're not hearing from you, if they are not prioritizing, then you're not going to get the resources that you need, and we are going to see a disproportionate impact in our communities. So this is going to be, part of I know everybody does it already, but this is one of the things that, we need to be on a call the mayor up basis to talk about what our people need. And I'm not going to go over all the rest of the points here because Colleen already did. But again, I love, she talks about going to the party store and getting the hand washing. Your states may not have been hit as hard as we are in King County, Washington right now. Are there still party stores with hand washing sinks? You should start looking right now, because as soon as your states are hit to the impact in which we're having right now, you will not be able to find those. And so do whatever you can and make sure that all bathrooms and sinks have soap. And drying materials, because that is really important for us to ensure that there's no point of having the water if there's no soap. And also encourage all your clients to attempt to the best of their ability to wash any utensils, to not share plates, to not share drinks. Whatever you can do to up that education, because that is another way that it would spread, is by the sharing of utensils, plates, drinks, food, anything where droplets from their mouth could reach. It's just really important for us to, to really think about. Clients with symptoms. As Colleen said, she hasn't had anybody yet, but she will. And we here at the Seattle Indian Health Board have had clients with symptoms. Right now, we have not had any positive COVID tests, but we have had folks with symptoms, and we immediately put them into what we now have as a quarantine wing. Like Colleen said, maybe you have a small room, maybe you have an area where somebody could be isolated in there if possible, and then it's your communication and the work that you've done with your public health departments, relationships with local hospitals, how you're going to transport that client to go where they get the testing and the resources that they need, and if they do have COVID. Try to prevent any movement around the facility once you identify folks. You want to have a plan in place that says exactly what you're going to do if you identify somebody with symptoms. And if you do have isolation sites that become too full or overwhelmed, say you have 3 clients come in, but you only had the one small room, think about where you could put people where they would be the most isolated and where you can shift other parts, people in your facility to somewhere else. And know that as this continues, because we're here in Washington, we're a little bit further ahead in terms of how hard it's hit, but this is going to continue for a while. Know that these designated sites for quarantines, for isolation, the motel rooms, they're going to be full. So you're going to have to really think and strategize for what do you do when there is no space left, and how are you going to do the best harm reduction that you can for the relatives who come in your door. So these are all, we've been talking harm reduction strategies. I know we mostly hear this when we hear about substance misuse, but harm reduction is just that. We recognize that our relatives have risk, but we have to prevent the harm to the best of our ability and eliminate as much of that risk as possible, but to know that some folks just aren't going to be able to meet the standard of what we would hope that they would do. So I'm going to give you another example. And this goes to any resources that you can get on our website at the Urban Indian Health Institute, uihi.org. You can find all of our resources for COVID there. There's a series of 9 fact sheets. This is one of them. We know that a lot of our homeless relatives do have pets, and these pets are like their family members. They're the people, you know, they stay with them, they love them, they have a deep relationship with them. But the current recommendations on pets, if somebody is sick and they have been identified as either presumptively positive, or they need to go get tested because they have symptoms, or if they are tested positive for COVID, that it is not recommended for them to be around a pet. What are they going to do with their pets? More than likely, they may stay with their pets. And it is important for your agency to have a plan for any kind of pet care. For example, if you have a client who comes in who then needs to be transported to the hospital, what are you going to do if their pet is waiting outside? What are you going to be able to do? You may want to talk to local shelters, put a plan in place. But also, if they're experiencing these symptoms, they decide to leave your facility and they're going back out wherever, to an encampment, on the street, wherever they are, give them the best recommendations. So if they are not going to be separated from their pet, they need to wash their hands every single time that they have their pet. They need to use hand sanitizer, and suggest to them that they don't sleep right next to their pets. So I know that's another hard one, but suggest, they don't have to, if they're not going to, step away and give their pet to somebody else, sleep at least 6 feet away from their pet. So these are some of the examples of harm reduction, and you can actually find a handout on this specifically. We're calling it My Res Dog and COVID-19 on our resources on uihi.org, and we have a number of other resources there that are for high-risk individuals, folks who may be living with HIV, and other recommendations for some of our community members. And harm reduction is what we need to do with our homeless population. And part of that is going to be for us as staff members. I'm at an agency that serves some of our most marginalized people. We do have strong screening in place, but I'm doing everything I can for myself and my staff to reduce our risk as we are working in an agency that is likely to have more exposure than somewhere else. So the harm reduction strategies reach across. So after an outbreak, which I do want to be clear right now, we do not know when that is going to happen. I am a scientist. I call myself a storyteller of health from a Native perspective. I tell the stories of health through science. And what we know about the science of COVID right now is that there is no magical cure. There is no direct medication meant to treat this that is shown successful. There is no vaccine, and we shouldn't expect anything like that for at least a year and possibly longer. They just started the very first clinical trial. That means the very first testing of a vaccine here in, actually we had somebody who started the trial here in Washington. But we know with those kinds of things that it's at least 12 months to 3 years out from actually showing any results. So we do not know when this outbreak is going to end, so you need to be prepared for this to last a long time and what impact that has on your facility, on your plan, and on your staff. And as the science evolves, we also hear a lot of things that are wrong. A couple days ago, there was a whole bunch of information through social media that said, if you think you have symptoms, don't take a certain, not Tylenol, but don't take ibuprofen. Yeah. There's a big panic. Don't take ibuprofen. Don't take ibuprofen. There is absolutely no science behind that. That was just something somebody said. And what that comes down to is like folks who have long-term kidney and liver disease should not be taking ibuprofen. And you shouldn't take it for a long term because it does increase your ability to possibly get those long-term effects. But there, again, is so much misinformation please look at what your websites have for your local health departments. Follow the CDC, and you can also follow Urban Indian Health Institute at uyha.org, where we'll be sharing up-to-date information. And continue to talk to your clients and evaluate your plan of action as this continues.
One question that came up around just resources, like where the best place to go for like good information is one person asked in Seattle. We know that King County Public Health has a whole website devoted just to COVID response for the homeless community. So that's, you know, you can easily just Google that. Also, healthcare for the homeless is an incredible resource right now, and I know that they're in most cities. Also, they have their national organization too, so follow them on all the social media. They'll be continuing to put out some good recommendations. And then I know that with the National Coalition to End Urban Indigenous Homelessness and UIHI, that we'll be kind of taking those and making sure they fit with the Native community, because they don't always work.
Yeah, so if you go on our website, what we've taken is we've adapted information to meet the needs, and you can actually download those as a template. You can put your own, you know, you can put your own logos on them. You can change and update local information for folks, but we're doing that everywhere we see a gap. And so if there's a gap that exists, like example for pets, we know that our Native folks, a lot of them have pets, and we as Native people have relationships with our four-leggeds and other creatures, and we want to make sure that that was respected. And so as we identify gaps, we'll have information there. But again, expect this to last. And as you look for information, don't use social media as where you're getting your info from. Going to these reputable websites, CDC, if nothing else, you can go to the CDC, UIHI, your local health departments. Do not depend on your cousin's brother's first cousin's wife for any kind of real information and the science that backs that up. As Native people, we have always followed a protocol. And that's what these plans are. That's what we're talking about right now, is that we have protocols for ceremony. We have protocols for taking care of elders. We have protocols for our babies and our youth. We are putting new protocols in place, and we are adapting to our community and using the strength of our knowledge systems and our ability as Native agencies to get information to our people so that they can get the most up-to-date protocols for them to understand what they need to be doing. If you don't have an emergency plan in place, you need to do it. On this website, we'll have links. For example, the one that you can get that the state of California put out, we'll have some other links. We have a resource, a whole page of resources where you can get information. And so that will go out after this webinar with the link that goes up that has the recording of the webinar with those links. And also, we are going to experience deaths within our community. We know that there's already been a death of a Native person in the country from COVID, and we have to allow the time for mourning and grief. Do know, for example, here in Seattle, we are not allowed to have funerals, and we are going to have to adapt our cultural practices to keep our loved ones safe. So for Colleen and I, for many of our funerals, they last 3 days. And that grieving is very, very important to us. It's what allows us to move through such a loss. Think about how are you going to allow that grieving to happen within your community as these deaths occur, because they will occur. And so you're going to have to think about how do we allow for this grieving in a time where we can't even have a funeral right now in the same way that we would have normally. Maybe it's done over Facebook like we're doing now. Maybe it's done in different ways. But we have to plan as Native people and adapt to this, what is happening right now, to allow for that mourning and for that grief to happen as this outbreak continues, and then afterwards. Again, in this kind of follow-up plan, have a plan for your staff, because your staff is the front lines, and they maybe start feeling numb to things. Like they aren't feeling the emotions that they would have normally, because it just keeps coming and keeps coming and it keeps coming. And we know that we see that in burnout. This is going to amplify that. Start putting plans in place now on how to work with your staff and to love them and to wrap ourselves around them as a community to allow them to go through grieving processes that they'll need to do, and for them to be able to continue to serve our clients and relatives well. So that mourning and that grief, as you all know, is beyond just the population of incredible people we serve. It's also for those of us who are in the work every single day.
I'll just jump in on that, and I know we're running short on time actually, but you know, one thing we tried to do with the Chief Seattle Club staff is to say, go outside, take a break, go get, you know, we have a Starbucks that's still open that's close to us, so go get it. We gave everyone gift cards. Go get out of the actual space and building and just take some deep breaths, get out in the fresh air, little things like that. You know, we've gotten pizza for our staff. The first day we did screening for our members, which we never do this, but we bought donuts for everybody, just to try to offer a little comfort, just because it is so crazy and hard right now. I wanted to address a question too that says, any resources on why lack of shelter makes crisis worse? And I'm not exactly sure how to answer that, if I understand the question, but I think that it has to do with the real reality of that a lot of our folks don't want to go into shelter. So I'll answer it in two ways. One, the shelter system is just so packed tight that there's just tons and tons of germs going around, and if you're someone in your area who has COVID, the likelihood of you getting it is probably pretty good. The other thing is that for our folks who are outside, we thought about this quite a bit at my agency. You know, like, well, if they're outside, maybe they're safer, right? Like they're out in an encampment, you know, but the reality is that they have to come and get resources, right? They have to get food, they have to find bathrooms, and if they don't have, sometimes people are just out there having very unsafe practices. So we think that it's a fine line. There's some, you know, we need to get people the resources inside of a building so that they can just maintain their daily bodily functions. And then also we need to find ways to keep them safe out in the encampments. There's another question that says, what do you recommend putting in a kit? I think the number one thing is just soap. To, even if it is like Abby said, shampoo or whatever, even if they don't have enough water to like as long as they're, you know, the harm reduction piece of that, even if they can't do it as well as they would inside of a building or in a bathroom, it's still important to try to get it out there. The other thing would be traditional medicines. Again, you know, sage, sweetgrass, things that purify them around there. You know, we just handed out a ton of these smudge sprays that people will take out to their shelter or to their encampment tonight. And then finally, hand sanitizer. As much hand sanitizer we can get people. If you're in an encampment, that is just one way to protect.
And one of the things that we know that there's a national shortage on hand sanitizer. You can make hand sanitizer. Mm-hmm. Sometimes it can be a little bit easier to get those supplies. You can easily find, there are lots of recipes online, but you can make hand sanitizer and you can get them in little spritzers. So we've done that here at the Seattle Indian Health Board, is make a lot of hand sanitizers for our staff who are non-clinical medical providers. So we need to really be thinking about, again, harm reduction strategies. If we can't get it, what is the next best thing that we can do? And we need to plan for that now. And really thinking about, as you have your emergency plans put in place for this outbreak, that you think about those, because things will run out. So think about that now so that you can plan for it and have those plans in place for the future. And one of them, and Colleen, we actually have the webinar open for another half hour. Oh, okay, so we're good.
Okay, well,
she's gonna have to go. She's gonna have to go in a minute, but we'll be able to answer some more questions after that. Right. But we really want to ensure that for public health policy recommendations, you have to be actively pushing these right now. Prioritize homeless people during outbreak. My God, Number one, every public health jurisdiction, every state, that should be the top of every single plan. Prioritize homeless people. And that means the allocation of resources will be much easier for you when you go searching for them. So look at what's been happening in California. We'll have the links to that in our resource page. Prioritizing homeless people for quarantine and isolation facilities. Excuse me. They should have the number one things that they should have. Sorry, choked on something. My sister's hiding from me because I coughed. I choked on something.
I'll use my 8th generation scarf.
Yes, she now has a mask. We need to make sure that when those beds come open, that Native people are the number one priority for those. Yeah. And we need allocation of resources for non-standard equipment that we haven't been getting and that we normally wouldn't use. Personal protection information, things. For example, you probably haven't had the need for full medical gowns in your facility before, but if you have somebody with COVID symptoms, you should be using PPE, so personal protection equipment, getting those mobile hand washing stations, making sure that they're allocating the resources you need for this. And There are also possibilities of working with your public health jurisdictions to have dedicated public health nurses in your facilities. So you will need to actively work with your social service, other social service agencies to get your public health jurisdictions and the states to do that, but it's not impossible. Make the ask. If we don't make the ask, then we don't know what's possible, and we need to continue to push to ensure that our relatives get absolutely the best.
I think that just regular communication with all of your departments of public health is incredibly important right now too, because they're right now on the fly making policies, and they're all evolving, and so having your voice out there is just so incredibly important. Again, I would say the healthcare for the homeless is another resource. I'm gonna have to go in a second, but I just want to answer this question. Okay, where did you get the spray you mentioned, and can it be purchased? Actually, we cannot sell it, but it was made by Valerie Segrest. If you check out the Chief Seattle Club Facebook page, we have pictures of it, and we have what's in it. I know that she had a distillery, and she was like distilling it and doing awesome Valerie Segrest things. So that's where you can find that. I think you can easily make that yourself, but
yeah,
we just think that's one way to give our members protection. The other thing about it is just also like, hey, we're noticing you. We believe in you. We know that this is a hard time, and this is just one other comfort that we can give you. So we also want to talk about, another question was equivalent organizations to SIHB and Chief Seattle Club in Alaska. We know that there is a Alaska Native Tribal Health Consortium, which is just incredible. I'm sure that we know the people over there. I'm sure they're responding in incredible ways and are coming up with plans. There's also South Central Foundation, Cook Inlet Housing Association, and Cook Inlet Association. They're just incredible agencies up there. But our homeless community there does not have a dedicated place for Native people to go to. There's Beans Cafe and St. Francis Shelter. Those are the two that I know of. But I think that this is a really important time for our Alaska Native relatives and the corporations to be thinking about how they could respond. Like this is a time. I've been thinking that even though that this is really hard, and I know that there are people that are going to really suffer from this, but I also have been thinking this as an opportunity. There are some people out there that we have not been able to reach, and now that we have some resources to put people in motels. Well, I'm thinking this is the beginning of a case management relationship with them to help support them into their next into their journey of wellness. So be thoughtful of that you know, we're going to have to be putting extra resources towards our homeless community, and it is not going to go to waste. It is the beginning of a relationship and that next step and journey towards wellness. So
yeah,
long-winded
answer, but that's okay. So actually, Valerie Segrest is an incredible traditional medicine person here in Muckleshoot area. We're on Muckleshoot and Coast Salish land here in Seattle. And she has incredible resources, and we're going to be sharing some of those resources, and are actually going to work with her and some other folks to put out some traditional medicine things. Again, follow us at uihi.org and also on our social media. We're going to be doing things like outside of this, but I think it would be helpful, especially for families who have young ones who are getting really afraid. We know that there's a lot of fear and anxiety around COVID right now, and fear and anxiety weakens your immune system. So our fear and anxiety is actually making us more likely to, if we're exposed to getting this virus. And so how do we keep our immune system strong? And that is through sharing information in a way that is trauma informed, gives the best information, the best harm reduction, and offers solutions in doing that. So we have that on our site. We're going to be working with a Native artist who is going to be creating cute little illustrations on how to talk to your child about COVID, and this would also work with our homeless relatives with children. And we're going to have Valerie and team creating some things that we'll be sharing, including, I don't know if it'll be this exact thing she's doing with the Chief Seattle Club, but it will be some traditional medicine ways. Again, even making those medicines, we know as Native people that that is a calming, that is being in touch with our ancestors, and that boosts our immune system by being in that space.
Yeah, my son picked up some of his beads and has been beading, and I think that's really good for his anxiety. For my anxiety, I'm a terrible beater, but it's really important. It's medicine, it's prayers, and so it's a good time to be picking up all of those all of those medicines again and be doing that. And I am going to have to
I was going to
take
say,
off. My apologies, but I
thank
have
you,
to
Colleen.
run back.
Thank you, Colleen, for coming in. And
WYHI.
everything that Colleen, this whole webinar is going to be available online. We have a resource page. And in addition to that, I have more questions here that I will be answering, and I can answer a number of those questions. But I want to thank Colleen for coming and sharing her information, and follow the good work that they're doing, because she keeps putting stuff up on her social media at the Chief Seattle Club. Again, as we are in the epicenter of this breakout, the lessons learned we want to be able to share across the nation so that we can learn from each other and not be reinventing things that we've already discovered that could be adapted in other communities. So thanks, Colleen, for coming, and I will answer the next question, which was, are there any resources on Indigenous methodologies for secondary trauma and burnout for service providers who care for American Indians and Alaska Natives? And yes, there is. One of the best resources, and they may even offer some online trainings, is from the Native Wellness Institute. They have incredible resources that are for people who provide social service to American Indians and Alaska Natives, and I highly suggest them. So again, the Native Wellness Institute, and they're actually doing, they've just started this, I believe it starts either Saturday or Sunday, but they're going to do just a weekly 1 hour come talk to some of their folks, and it's specifically around calming anxiety and trauma around this COVID outbreak. And so follow them on their social media, and you can look at their website at the Native Wellness Institute and see resources for folks who get secondary trauma and burnout from COVID. In addition, I have another question here, and it's really related specifically to the Seattle Indian Health Board. So those of you who are joining us on this webinar locally, when will SIHB receive any COVID-19 tests? So that is a really good question. We as an agency have been dedicated to providing whatever we can and every resource as we could to our communities. There was a point where we received a very limited number of tests. Very limited. And at this point in time, we do not have any tests that we can do for the general public. And we have not been restocked by the state, and nor do we currently have what we need to do the test. So to do these tests, if you go to websites like the Indian Health Service, and you'll see the CDC saying, well, all clinics needs is a swab. That is not true. We need more than a swab. We need what is called the medium, that once you take the swab, goes into what they call a medium. It's like a scientific term, and it holds that swab and all of the bacteria or things that may be present in that swab that then allows it to go for testing. We do not have all of those materials in order to provide testing here right now at the Seattle Indian Health Board. And it's not because we wouldn't do it. We simply don't have the materials to do it, and that speaks to the lack of materials to do adequate testing, not only here in the state of Washington, where we have had the highest number of deaths from COVID, but across the nation, we're going to continue to see the lack of testing materials. So here at the Seattle Indian Health Board, myself, our CEO, our CEO, Esther Lucero, and our person who handles all of our policy, Aaron Sparks, we have been actively working at the national level to ensure that we begin to get some access to supplies from the Indian Health Service. And we are working again at the national level to ensure that American Indian and Alaska Native organizations are included in the stimulus packages that are coming. We are educating and advocating for our people every single day. And we would be doing tests if we could simply get the resources and the testing equipment in order to do those, to do them right, and to do them safely. So we're actively working on that, and I know that we cannot be the only medical provider who is experiencing that right now. In addition to that, we currently do have some of our programs that are still open. From a harm reduction perspective, our elders program here at the Seattle Indian Health Board is still open, and we have done that because we know most of our elders program are predominantly homeless. And so where we may not operate in the same number of hours or be doing the same activities, they can still come in, they get screened. We want them to come in and get screened because we can get them right to medical care. And we provide them now our meals. Instead of doing the meals family styles we would normally do, they're getting individually packaged meals so that they get fed, they get their medical medical check every single day, and they have somewhere warm for a couple of hours before they head back out on the streets. And so again, this is a harm reduction perspective. We recognize that because they are predominantly homeless, we have a responsibility to continue to serve them the best way we know how. And as this situation evolves here in the state of Washington, we have evolved our services. And so that's again why an emergency plan is incredibly important. Here at Seattle Indian Health Board, our emergency plan was 3 phases, and we are currently in phase 2 of that. And so we have planned for every level of emergency that we could possibly get to, so that we can continue to serve our staff well and also serve our relatives who come here for their community services, traditional health, behavioral health, and primary medical care. Any other questions? Do you have any other questions coming? If we don't, I just want to say thank you to everybody who has been on this webinar. We, again, are loving our people in a new way by adapting to this situation to protect the next generations who will come after us and to serve those generations like our elders who came before us. So again, this isn't about fear, this is about adaptation, this is about serving our relatives to the best of our ability and knowing that every single one of them is important, and that's why we take these strategies for harm reduction. And in regards to our phase 3, I was waiting for that question. What does phase 3 look like? I cannot share that with you right now because I don't have permission from our CEO, but I will let you know that it takes into consideration what recommendations would come from the state and the CDC and implements those. That includes safety for our medical providers, for our staff, and for our patients. And so I can't share with you phase 3 because I do not have the permission to do so from our CEO, but it will be following all of the CDC and the state's recommendations on health, wellness, and safety, and also recognizes that we are a safety net clinical provider for many of our relatives here. Do I have one more? So I do see, what are the recommendations you would give for clients who are trying to flee domestic violence and have no shelter availability? This is a huge problem right now. And in fact, we do know we have the Strong Hearts helpline, and we know that a lot of folks right now are sheltering in place or are staying home, and they are in a place where their abusers may be continuing and probably are continuing to abuse them, and the stress and anxiety of this COVID could be amping up that abuse. Right now, our recommendations are, again, to prioritize and stepping outside of just the homeless, but also prioritizing for shelters and for other facilities for both the public health jurisdictions and the states to prioritize folks who are in domestic violence relationships and looking to escape those. But also, you know, in domestic violence, which I worked for many years in, is that we just have a lot of people who are surviving day to day. How do we provide to them services even though they may be staying with their abuser? So making sure that we have resources available, that we are doing everything to convey information about COVID in a trauma-informed way that doesn't increase fear, but instead talks about how we're showing the love of our community by adapting to this situation, and recognizing that, again, we need to prioritize services for those most vulnerable in our community, which would also include those who are currently experiencing domestic violence. All right, so I do see another question in here about being, if you have been diagnosed with bronchitis, pneumonia, and treated, should we be concerned with having the virus? And so I am not a medical provider. I am a scientist and more of an epidemiologist, and so I cannot provide any medical advice on this. I will say that the recommendations are, if you currently have any kind of respiratory issues or symptoms, then you could be at higher risk for that. But in terms of like it being medical advice, I would suggest that you go ahead and call a provider. Right now, almost all providers across the country are doing telehealth, which means you can just call and talk to somebody. They can do it right now. We just had HIPAA protections lifted by the federal government, so they can actually, we are seeing folks do telehealth via like Facebook chat. and other videoing methods. And so definitely reach out to a medical provider and talk to them about your situation. If you are currently experiencing respiratory issues, it could put you at higher risk for contracting the virus. All right, so we don't have any more questions. I want to, again, thank everybody for participating. This webinar will be available, posted on our website on Monday. We have resources at uihi.org, which includes resources for homeless service providers. The PETS one that I mentioned. With this webinar, you'll also see a resource page when that is posted, and we'll have all the resources that we talked about. And if you have any other questions, feel free to continue to post them on our Facebook page, and we will answer to the best of our ability. And if there's anything specific for Colleen, I can just call her on the phone and have her answer those, and we'll type them into the Facebook chat. So again, thank you, and thank you for all you are doing for our relatives every day. Thank you as individuals for keeping yourself and your community safe by physical distancing, but keeping us all socially close. And that means continuing to share our knowledge as Native people and knowing that we see a great future for all of us as we adapt to the situation and love our people more by staying physically distant. So thank you all. And if we're, again, resources, you can go to uihi.org.